Hi, everybody, and welcome to this Red Cross presentation that's being sponsored by the Emergency Volunteer Corps of Nehalem Bay. My name is Margaret Steele, and I'm the president of the EVCNB and other duties as assigned. And for those of you who don't know, the EVCNB is a nonprofit organization that is dedicated to building personal, community, and regional resilience and developing programs to ensure readiness and promoting a culture in our community of emergency preparedness. And within this mission, there's a multitude of functions. We have an emergency response division, which is led by our former president, Linda Kozlowski, and that includes emergency communications, community emergency response team, CERTs, you may have heard of, the Medical Reserve Corps, which Velda and Kate are the heads of, and it consists of healthcare volunteers, and then the shelter division, which Velda is also the head of. We have a communications lead, and also she is also the NCRD shelter coordinator, and that's Karen Sarniker in the back. CERT lead is Joe Cooper, also in the back. And as I said, MRC is directed by Velda Handler and Kate Grimm. And shelter leads are Velda for this shelter, and the Wheeler City Hall shelter coordinator is Heidi Stacks, who's back there. And there are three primary shelters, one here at Calvary, one in Nehalem at NCRD, and one in Wheeler at the City Hall. In the event of an emergency, these shelters can be opened initially as community shelters, and if there's a need, they can be transitioned to Red Cross shelters, either Red Cross supported or official Red Cross shelters. When our community faces an emergency, each of these emergency response and our other functions in EVCNB can flexibly integrate and collaborate with one of our most vital partners, the Red Cross. EVC has provided a lot of volunteer service since we came to be in 2009, 2008. And in the last year, from July 1st of 2020 to June 30th of this year, we have recorded almost 11,000 volunteer hours, including 4,000 COVID response hours. We're very thankful to the leadership of each of our shelter facilities and supporting partners. The facilities are designated as both community shelters and Red Cross shelters in order to maximize our flexibility. And Calvary has generously invited us to hold this meeting here, so we're glad to have you here. We're privileged to have Victor Magana, our Red Cross Cascades Regional Disaster Program Manager. That's a mouthful. With us this evening. He's an advocate for emergency preparedness collaboration and works closely with those of us who are Red Cross volunteers and other Red Cross volunteers in Tillamook, Clatsop, and Columbia counties. Victor will share some of his background and goals with us this evening. Thank you for being here, Victor.
No problem. Thank you so much. So good evening, everybody. Thank you, everybody, for coming out. So just a little bit of history of me before I get into what I really do. I was a Marine for about 14 years. The last place I was at is in Arizona, so acclimatized to the heat. I'm very comfortable in the heat. I did a few deployments of that. And then everything I've done has been in emergency management. I have a bachelor's degree in emergency management from Arizona State University, and a lot of the volunteer stuff that I've been doing is in disaster stuff. That's just my cup of tea. I really enjoy working in disaster, not because disaster is fun, but because disaster is challenging, and the way that we collaborate is always very interesting to me to build on what we can and identify where we need to work on. So those elements really kind of got me into that space. So I was a Red Cross volunteer for 2 years before I became an actual disaster program manager. And it was always the disaster stuff that I was supporting. And I also volunteer with Team Red, White, and Blue, which is a veteran organization for socializing, kind of getting the network. And I also volunteer with Team Rubicon, which is also a disaster nonprofit organization that does that. And each organization has its foothold as far as how they support the community. Hence why I always enjoy kind of figuring out what those elements look like in the communities. So as disaster program manager, my whole role is supporting the communities. That goes from from the county to the cities down to the actual partners and community members themselves, to include the volunteers that do that. So geographically, as far as how we support that, it really comes down to what those resources are, what are the partnerships that we have in the communities, and then the amount of volunteers we actually have, and then how we kind of collaborate within those elements. So it makes it a little bit interesting as far as how we find and problem solve. It's going to be unique to the community as far as what is going to be the strength and where we need to grow, and where there's sufficient enough support to see where that extent of that support really looks like. So that way we can plan around making sure the burden is alleviated, because any one entity is a huge burden to take on overall to address all the needs that the community will eventually need for that. So hence, that's why I try to collaborate and try to figure that out, because we are nonprofit, we are driven by volunteers. So any services that's provided, it's not Victor doing the services, it's me supporting the volunteers, which is 90% of really what does make the difference for those that need those services. And another component too is that, everything that gets donated as far as financial assistance and stuff like that, we go back into the community. It's for every dollar, 90 cents go back to the community, meaning that family member that's impacted, it's going straight to them. So really the minimal amount that really stays with this is just kind of making sure that there's an employee to kind of support the volunteers that make all the difference in the community for that. So that's roughly how that kind of functions. So in this role, I've been doing this for about a year and a half. I understand the space very well and understanding what the challenges are. I've been to multiple disasters, every one single ranges of that. So I try to bring that experience and that best practices to every community to try to resolve that and try to find what's the best grounds to kind of work on that and see who's going to be at the table to kind of support that element. All right, so any questions initially before I kind of go over some of the information I kind of have for you guys? So, and I will say in advance, I can be a quick talker. So if you need me to slow down or clarify, please by all means do so. You don't need to hold your questions to the end. Please ask questions as we kind of move forward. I'm quite flexible with doing that. So as you know, as far as the Red Cross, there are multiple lines of service, mine especially in more disaster cycle services, but we have a total of 5 of those. I'll briefly go over those. But just so you understand, as far as volunteers or services and programs, each one of those either kind of crosses over or has the ability to bring awareness of how to be involved with the Red Cross. So if disaster is not really your forte or really your interest in how to be involved, there is an opportunity to be involved or partner up with the Red Cross. That doesn't have to always be with the disaster stuff. So a few things that I kind of introduce myself. I always make sure as far as where the first aids and AED or CPR people that are trained to be able to do that. As far as restrooms, we will have a small break in between. I'm not trying to drag this out by any means, but I want to make sure that as far as everybody's kind of being attentive and we can kind of stretch out for that. And then also, as far as I already silenced my devices, and then if you signed in, please, that way that we can track that. At the end of the day, I just need to track how many people attended, and that's pretty much all the information I'll need for that.
The Red Cross has a lot of values and principles that kind of mirror my own. You knew that if you saw that Red Cross logo, it meant hope. And I really wanted to volunteer. Every day, Red Cross volunteers like myself, we're helping people, our neighbors, recover from disasters. We're helping people to respond to home fires, floods, and any other disaster that may come our way. We have fire safety, try to make sure their smoke alarms are working. We go out and actually take care of people who've been displaced due to disaster. And then the recovery process, that's where we actually provide relief, short term, and help them plan for the long-term recovery. I've been on about 14 disaster responses. The last few, just this year, we're seeing people that are potentially on the worst day of their lives. And we are able to provide at least a small amount of hope that somebody actually cares and that there is going to be a chance for them to get back to a normal life. And being able to actually go out and provide assistance to them and see the gratitude makes all the efforts worthwhile. The American Red Cross, for me, is an organization that has a long-term history. Whatever you do is actually going to make a difference. You're going to be given the opportunity to really give back to the community in a meaningful way. And I love it.
So obviously that's more focused on the actual disaster component of those things. I have a different video towards the end to kind of do that. But one of the main components usually people try to ask as far as where to volunteer, why they want to volunteer and stuff like that. And that's really where I focus on and try to facilitate as best as I can. So usually I try to make sure we figure out why the organization, why did they choose the Red Cross, some of those elements that kind of go into that. And it has a very degrees of why people want to do it with the Red Cross. Also, as far as how we are the ones that make a difference in the way that our services support that, and our different programs that we have that kind of support at different times whenever there is a disaster, before that or right after that, and even during, which is what we're known for as far as like sheltering and stuff like that. But there's far more additional programs and abilities that we try to facilitate within the community to kind of be able to do that. And a lot of times that those volunteers that are in those spaces don't get seen from that, but there's a lot of work that gets done through that volunteer opportunity that doesn't always have to be showing up at the shelter necessarily, which is a huge element, but being involved in those conversations before a disaster occurs or after a disaster occurs, how to integrate programs that are in the community and how to connect with people and making sure those immediate needs are still being addressed moving forward. As far as and also what does it mean to really be a Red Cross volunteer in disaster services, which we have also biomedical training services like CPR instructors and stuff like that, and international services as well, and then service to the armed forces. So disaster cycle services is its own niche, its own culture, its own style of the way that we socialize, because all that we know to function is within chaos and organizing chaos and supporting people and really being there for them. And I always try to tell people as far as the volunteers that are supporting these programs are the ones that are supporting the community themselves directly. All right. So as far as like how I support them is making sure that I enable them to be able to have all the tools, all the resources that they can to create those opportunities to continue to make an impact and try to improve and kind of provide that information for people. As we kind of always provide a lot of these components, one of the common depictions that we try to figure out is what do you kind of see in here, and what do you think is probably the most common thing that we always associate when we're providing help? What's that? So usually what we try to always do is that as people are in their worst day, the Red Cross usually when they show up, they see a little light of hope. And that's what we try to carry on. Because a lot of times, even when we deal with like single house fire, the first responders are there, they're taking care of the fire, they're taking care of the safety concerns, and then that's it. Like the services end right there because that's the way that service is designed. But then the Red Cross shows up if we get notified, and we're there to help them navigate their recovery moving forward. We're focused on the household, we're focused on the actual people, we're taking care of the humanitarian factor of being there for them and helping them navigate that and figure out how to kind of use the local resources and also providing resources for them so they can figure out how to move forward. Because no one really knows what to do right after you have a disaster. You don't know if you're well prepared, if you're going to address all those things. There's going to be so many things going on, and having somebody to kind of bounce that off of or just get that emotion off your chest, that's what the Red Cross does for people, and showing up and at least knowing that there's things available to them that they didn't plan for and kind of be able to move forward from that. A lot of times, as far as why people want to join the Red Cross, and everybody think as far as why most people really try to be associated with the Red Cross or volunteer to the Red Cross?
It's well known.
What's that?
Well known.
It is well known, yes.
Credibility.
There's a lot of credibility with our organization as far as what we do. Anything else?
They want to help people.
They want to help people. Yeah, it is that common factor that we have as far as want to help people, the credibility that's associated with that. Everybody has a different reason why they want to join the Red Cross, and the reasons that are there all mutually come down to that we are caring people and we want to be there, support them, along with some other tangible components or other reasons that may support us even as individuals through the Red Cross itself. So some of those things, like it might be because you're personally impacted, so you want to pay it forward. Sometimes you want to gain some experience, or it's spontaneous. There's a disaster, I want to show up and help. People want to get educated through us. Some people want to develop leadership in their own community, have opportunities to be leaders. And then also a lot of other additional components that come to that, but all of them coming together, eventually that might be their starting point, but eventually they see that, what they're doing and how they're delivering the mission as far as what we do kind of helps support, understand really what is available in their community and how they're helping moving that forward. All right. So that allows us to be very diverse in our experience, skill set, life, time and wherever we're at in life, to bring that type of element and really kind of advocate for the people that you're hoping that you can help out in your own community. So as far as our mission for that we have for the American Red Cross is that American Red Cross prevents and alleviates human suffering in the face of emergencies by mobilizing the power of volunteers and the generosity of donors. Like I said, for every dollar, 90 cents goes to the actual homeowner. But the thing is, as well as volunteers volunteering their time is also donating time that we wouldn't be able to move programs forward. And a lot of communities really rely on volunteers to be able to move certain things forward because you just don't have the ability to have resources, staffing, or hiring opportunities to create those spaces that really are needed. It's very challenging, so therefore volunteers are really, in essence, to be able to do that. Like I said, our programs are really driven by the volunteers, or else we wouldn't be able to provide those services. So we always kind of stay within our fundamental principles as far as humanity, impartiality, neutrality, independence, volunteer service, unity, and universality. The great thing about us as far as how we can as a neutrality component for a lot of conversations that we have with different partners or people that want to have a conversation as far as anything that might relate to any of the programs that we provide. So that neutrality for us to be able to partner up with everybody allows us to kind of do that, and a lot of times allows people that may not have a voice at a certain topic can be welcomed through that channel. And we can also reach out to those people because we know that, holistically, we're trying to look at the whole community, how to address those concerns and finding the right fit for those areas. We always try to make sure we facilitate that as much as we can. So that neutrality really allows us that space to be able to do that in order for us to support all people that we kind of try to address. So as far as how we accomplish the mission, our vision is to, through its strong network of volunteers, donors, and partners, is always there in the time of need. Make sure we do that. And our values as far as compassionate, collaborative, creative, credible, and committed, those 5 C's really kind of drive that home. And you'll see that in volunteers, kind of like what you saw as far as in that video of that gentleman, that compassion of helping people, being there on their worst day is part of why he stays involved in that program as far as house fires and stuff like that and other different components that we can do in the community through the Red Cross. So like I mentioned a little bit earlier, as far as our different lines of service, somebody in your community may know the Red Cross for one of these and may not even know that the other ones exist. It's very common. A lot of people usually, when I've driven around to, especially these coastal counties, are like, oh, you're with Blood Services. Where's the next blood drive? And I tell them, yes, we do, but I focus on disaster stuff, so can we talk about that? But I always make sure that we understand that all those lines of service have their own way of delivering service and helping people, but being aware that you can be involved in any one of those or multiple of those, which I have quite a few volunteers that have like 3 different lines of service that they support because they have a passion for that. They have the time for that, or is really driven by one of those reasons of why they want to continue doing that. The only reason I'm here as far as really trying to pay it forward for the Red Cross is because through the service of the armed forces, when I was active duty, the Red Cross was there for me that I didn't even know that they were for. One of their services helped me in a time of need that I didn't even know. My wife was in a different place. I was training. I didn't know how to go back home. The Red Cross sent a message, let me know that my wife needed me back home, and within 17 hours, I was back home. But that was because of the Red Cross. I didn't know that, but the only reason she knew about it is because there was a volunteer that was a nurse that knew about the service. And she was involved in that. And just that awareness of that information of just knowing that the Red Cross did that helped me be where I'm at. So sorry about that. So, yeah, it always gets me. But that's because, one of the lines of service, and we always try to advocate that, is being aware of what the services are is half the battle. Even if you're not completely involved or just talking to your neighbor or just hearing about it, there may be something that someone will connect with them and be there for them. So, National Mass Care Strategy. Anybody ever heard of that before as far as what the National Mass care strategy is. A couple of you that kind of work within that space. So we have basically a document. I didn't print out the whole thing. It's a little bit thicker than this. But this mass care strategy is basically something that's been created by multiple partners, Red Cross being one of those, FEMA, the National VOAD, a lot of other entities have been involved in this type of document, and it really kind of establishes us how we should approach the way that we provide mass care strategy. Now, it's going to be unique to every community, but it has the framework which we can base that on, and the philosophy that kind of bases that off of. So one of the things is that the term of mass care, just by itself, refers to a wide range of humanitarian activities that provide life-sustaining support to individuals and families who are temporarily displaced or otherwise impacted by a disaster or emergency that disrupts their ability to provide their basic needs. Mass care services begin as soon as the disaster is imminent or occurs and continues through the recovery phase. So as we see on the coast, on the East Coast, as far as when there's a hurricane coming, we start getting those services up and going because we know it's going to happen. So that way, as people are needing to be displaced, they have services available to them to address those basic needs. It's part of that strategy to make sure we continue to provide that. So the whole concept of whole community is what we really want to make sure we address and we understand how to be involved with that, which basically means that with residents, emergency management practitioners, organizations, and community leaders and government officials can collectively understand and assess the needs of their respective communities and determine the best ways to organize and strengthen their assets, capacities, and interests. By doing so, a more effective path to societal security and resilience is built. In a sense, a whole community is a philosophical approach of how to think about conducting emergency management. So that's, in a mouthful, basically looking at like the whole community really is going to end up being the one supporting those needs for their own residents. And those same residents that are going to be providing these services might also be impacted. So we want to remove some of those burdens by having support from other organizations to alleviate that burden, so that way the whole community is still being supported overall through the whole process. And then one small thing that I want to add to that real quick is that ensuring our nation's ability to provide life-sustaining services immediately following a disaster event and fundamental responsibilities of government at all levels, as well as the mission of any governmental and private sector organization. It's inherent value embedded in the culture of this country to assist each other during times of need. So as you see, neighbors helping neighbors is already inherent. So we're trying to capitalize on that element by making sure that we're planning around that, addressing what those needs are, and we can find best ways that we can collaborate and alleviate a lot of duplication of effort and maximizing our efficiency to support the community needs for that. But one thing that usually will happen is people get frustrated by a specific organization when they can't provide all these resources, and that's a huge burden for any one organization to do. Hence why we want to focus on a whole community supporting that instead of just one entity kind of driving how a lot of these services are going to be provided for that. So that's one of the things I just want to make sure I highlighted for that, because a lot of times they'll say, well, the Red Cross will show up and be able to open a shelter. That is our hope to do that, but there's a lot of things to make sure to do that. You know, one of the things is if I have volunteers available, there's access to the roads, whatever those needs are being addressed. Yes, I want to make sure we could do that. So we want to make sure we have plans around that and build capacity that can be sustainable and manageable. So that way those needs are being addressed as those needs are coming up for the community. Any questions on that real quick? I just want to make sure I clarified on that. All right. So as far as disaster services, we provide immediate assistance after a disaster. So what do you understand as far as what an immediate assistance looks like, or what immediate need that we may want to address for the community?
Opening shelters.
Opening shelters, so a safe place to stay at. If you think about just the basic fundamental component of what your basic needs would be is a sheltering or a place to be at, feeding, all right, or maybe some financial assistance to get you by recovering some of the items you lost, or making sure you have access to medical care, or replacing your medication that you lost, access to someone to talk about what just happened and kind of understand, go through that process of emotionally understanding what's going on, your family members, stuff like that. So those basic, immediate needs is what we hope to try to provide, and hence why we make sure that every home that we're addressing that, whether it's big or small as far as disaster, is provided those services. Yes?
Who contacts you?
Yeah, great question. So that depends on two different things. One is, how scale of a disaster is, and then 2, if people know the phone number to call for just getting a hold of just Red Cross here locally, meaning what we have is we always have someone, as far as what we call a duty officer, that receives a call, figures out what the request of that need is to be addressed, and then we figure out how much support we need to do for scaling that. So if it's a single family fire that happens anywhere in as far as our counties that we cover, we can get volunteers to that. Usually that goes through the fire department, telling the 911 dispatcher to reach out to the Red Cross. They'll call the number and let them know, here's the address, this is how many family members are there, this is what we think their immediate needs are, and then we'll follow up by calling them and verifying what those needs are. If it's multiple people needing a place to figure out about opening a shelter, then that's when we start. They'll contact me as well and be like, hey, Victor, we need to figure out where we're going to place these people. They may not be able to go home for the next 4 days. Okay, now we got to figure out what our resources are at and start scaling from that and address those needs. Does that answer your question, ma'am?
Thank you.
Yeah. So that's one of those components, just kind of knowing for that. So we really rely on our partners, like first responders, to call us and let us know there's a need in the community, and then that way we can address that need. Or the city or the county lets us know, hey, there's a bigger need. Can you come and support? And this is what I think we may need for that. And then we start figuring that out together and then addressing the communication that goes around that. So when a family's home catches fire and they lose everything, we'll be there for them. When a house is flooded or a family is left with nowhere to go, we'll be there for them. And then also when loved ones are separated during a disaster and need to be reunified, we have a program that supports that ability to do that. You know, safe and well, you know, people that are out of the county or out of the state that don't know if their families are okay, if they check in with us, we'll track that and they can find out if they are okay. So we provide those services to make sure that people are aware and they can contact and at least be reassured or figure out how to best support in a different mean. So some of the common disasters, which you are probably well aware of that. The reason I have residential fires up top, I'll talk about that here in a second, but as far as floods, landslides, winter storms, wildfires, earthquakes, tsunamis, transportation incidents and hazardous materials, as long as it's a disaster with as far as all hazards, we'll be able to support that because our programs are designed that in that time of need, based off of disaster, our services are activated to be able to provide those needs and making sure we can support that. Residential fires are our number one thing that we are always addressing. On average, we get about 9 house fires a month. On average, and if you go into a more urbanized area like Portland, that probably doubles to triples a month. It just kind of depends how fluctuation of the season goes. And then the other component too is, out of a 12-month calendar, how many months do you think we are in disasters? A lot? So how many months out of that year do you think we're in disasters? 12? Just about, yeah. If you include house fires, yeah. Yeah, so our disaster season kind of runs about 9 months. So we have a low point, so that's a breeding time. And that's when we want to do a lot of preparedness, a lot of readiness, a lot of training, making sure people are kind of spun up for that. Yes, ma'am.
When is that break?
Yeah, so the break is usually between like end of January to the beginning of May. It's a very low point. Yeah.
Not around here.
Right, it varies by different area, but on average we are constantly in disasters going on, but usually there's a low point that there's certain programs will get activated and certain things, and like for here for us it'll change depending on those months because of the winter storms, the additional floods, exactly. Other areas, they'll see a low point at a different time frame and window to kind of balance that out. So hence, we're constantly really are always in trying to create a readiness. Hence why we have a cycle that we try to work through to try to make sure that, you know, as we're learning or improving, we can kind of adjust from that. So this is our little circle that we can kind of continue doing as far as what we do, which follows with as far as emergency managers. The only one that's missing out of there is mitigation, which is one of their components. But as far as preparing, responding, and recover, it's just cyclical, always constantly going on. Hence, each program is always working differently, and volunteers in those different programs will continue to be involved. So we'll have people that are only doing preparedness information, which we're phenomenally grateful for that, and never really do disaster stuff during a response. And that's okay, because that's part of the cycle that helps in continue improving to address some of those concerns to do that. And then other ones, you know, they only want to support when there is a disaster, so they'll only respond and be able to support. And other people want to care for them after they already dealt with the incident, and they want to help them recover to the process of doing casework, helping navigate what's going on, connecting them to local resources, and finding out how to best recover from that incident that occurred. So we have arranged for that, and as far as how we support that, everything always kind of goes through that same cycle, and in the cities and counties and states will go through that same cycle as well, as far as how they ramp up and kind of slow down depending on what their resources look like. So usually for our prepared stuff, a lot of things that you kind of will see on the table and stuff like that. It's making sure as far as be trained as a responder is what we hope for a lot of people to do, participate in exercise. We do also do exercises, meaning understanding how scalable it is, which are the partners that are involved in that, what is their piece of the pie in that exercise, so we understand how to work together and make sure that we can communicate that a little bit clear. And then also we do a lot of volunteer meetings to keep people informed of what's going on, what are our plans moving forward, which programs are kind of picking up, those type of things to kind of keep people involved. And we provide training opportunities as well. So some of the programs that we have is the Pillowcase Project, or Pedro, which I have a little Pedro coloring book there. And the Pillowcase, which is one of the programs I really love, and I'll talk about that here shortly. But we also do tabling events to try to talk to the community, let them know about how well they're prepared, and understanding how to work around that, delivering presentations. Smoke alarms, we also help with the fundraising and planning and partnering with community organizations to either support them on their events or having our volunteers be involved in their events, because we also want to make sure that our own volunteers that we do have are involved in their community, know what their community is doing, or be part of other organizations as well. The Red Cross can't possibly cover all their engagement opportunities or everything they want to be able to help with, so we want to make sure that they're being inclusive of how they want to be able to do that. So with the Pillowcase Project, who has never heard of the Pillowcase Project? All right, so the Pillowcase Project, or the Pedro Project, is addressed for school children. Pedro the penguin is from kindergarten to 2nd grade, and then from 3rd to 5th grade is that Pillowcase Project. All it really is a 1-hour presentation that we provide to kids. We do a drill with them of how to deal with an earthquake or a wildfire. And then we also talk about what they should start building a bug out bag or a kit or a pillowcase, so they understand of how to be prepared and start a conversation with the adults in the household and make sure to do that. And the reason why I love as far as the youth presentations we do that is that historically 70% of the children that get taught the education are more likely to have their household prepared than if I provide presentation to adults. Does anybody know why that is? Right, everybody knows why. We're procrastinators. We kind of say it's not going to happen. A lot of those, life things. But children are very effective at making sure that they're like, come on, where's this? My kid loves every time we got to update our bag, because they're like, Dad, I want to buy this one thing to add to my bag. I'm like, okay, we'll add one more thing to that. So he's always understanding how to make sure he's upkeeping his kit, making sure he understands how to use it and understand that element, and hence why that project is phenomenal at doing that. And we try to connect with teachers or other groups that have programs to provide the presentation to them, and especially for the pillowcase, now that we can go back and do it in person, we actually give them a pillowcase so they can actually start that. And the pillowcase concept is just really that, starting a kit. It was used back in Katrina from some college students that they had to leave their place, so they took a pillowcase, they just stuffed their stuff, and then walked over to the shelter. And then a Red Cross volunteer found out about that and thought that was phenomenal. So now we start teaching that to kids to learn to use that concept and have something that they can leave with, or at least understand that they need to build something to be prepared for that. All right, so that's why I kind of really focus on that. And then installing smoke alarms, those are free to anybody that needs those. So we don't charge anything, and we'll go and install them ourselves as well. We just need to identify the communities that need them, and people making sure that they test their smoke alarms, they understand all those components, and making sure that we actually go through an emergency evacuation plan or a drill with the household. A lot of times I'll ask homeowners, be like, have you actually practiced that drill with your kids and stuff like that? They're like, oh, they know what to do. They just follow mom and dad and go do that. I tell them, okay, well, what if you're not there and then they have to get out? Do they know what to do? And I'm like, well, so it's kind of a hard conversation to have, but also understanding a lot of times that you need to have 2 exits for every single room. I always tell them, does your child know if they need to get out through the window? Do they know how to do that? Do they know that it's okay for them to break the window and get out safely? I've done that at multiple little boothing events. Usually the parents kind of get stumbled. They're like, yeah, you need to do that, please do that. But that's because we never had that conversation on how to be ready, how to prepare, how to be realistic about those components, and make sure that they have a good plan around that. So we try to promote that and try to encourage them to make sure that they actually follow through with that and try to make sure they do the best with how to build what makes sense for that family. And then once we start responding to things, hopefully we got them prepared to do that and got them ready to do, making sure that we deploy people usually is what the appropriate position of a gap really is. That is a certification saying that you're able to fill a certain role during a response, whether that's in health services, that's whether it's going to be in feeding, it's going to be in sheltering, it's going to be in government liaison, all these different opportunities for us to take care of the community. That's what allows people to be able to deploy for that. Making sure people understand how to have that little go bag already ready to go, and then updating their availability to actually support a disaster, because a lot of people have multiple hats. So we want to make sure, like, if you get activated for one of the other entities you support, where does the Red Cross land on that? And be like, oh, I could probably help 2 weeks down the road. Okay, now we know where our capabilities to support other services looks like. We want to make sure we balance that out. And some of the approaches that we have is that the disaster action team, which is that single family fires, they're the ones that support that every single day. We try to open and run shelters in different capacities for that, serve food, distribute supplies, address personal disasters like mental health, health services, and spiritual care as well, which we have volunteers that do that capacity for them. So one quick component as far as open and running shelters, that really kind of depends on how we structure that. As far as how it's managed, and then also how it's coordinated for that. So if we had to open a shelter and it's a Red Cross managed shelter and I have volunteers to be able to open it from the very beginning, then it's a Red Cross open shelter from day one. If I don't have the volunteers, but it's still considered managed, then it falls into that supported role until I can get volunteers that are going to run the capacity as a Red Cross specific volunteer. So that's where that balance kind of goes into. And then sometimes we don't even have that figured out, or we don't have that resource, or we don't have the people to be able to do that. And then you have independent shelters or community ran shelters that solely they have to basically support that, and we'll be available to support them, as far as over the phone, providing subject matter expertise, but we just won't have people actually involved in a lot of those decisions that go in with running a shelter, documenting, tracking how available you are, stuff like that. So one of the things that we saw during the wildfires is that some of the faith-based organizations that they opened their doors, they couldn't sustain that very long. The wildfires ran for months, so they ran out of funds. People got burned out. We had to consolidate a lot of that stuff. So it was a huge burden to try to figure out how to make sure we were using our resources efficiently to make sure that people knew where to go. Because the last thing we want is that they're staying at one place for about 3 weeks and now they have to leave because no longer is capable. So now you're telling them to leave their temporary home to not go somewhere else. That's a huge frustration. We try to hopefully alleviate that by consolidating resources or focusing resources to where we can kind of figure out who's going to do what component so it's more sustainable and manageable, and we can kind of do that a little bit longer term for that. So those are some of the lessons that we want to always try to provide to the community so we can kind of figure out what fits that community and what specifically those needs are so we can sustain those functions to make sure we address those needs. Any questions so far? Yes, ma'am.
So, in an area like this, and let's say it's the kind of disaster that many of them are where nobody from the valley is going to be able to get out here, but we need a shelter. If for whatever reason we need to open a Red Cross shelter instead of a community shelter, you don't have to physically be able to get here, right? You can activate the Red Cross shelter volunteers that are here already, right?
Correct.
Okay.
Yeah, so hence why we want to make sure that there's a little bit of easy understanding as far as how the agreements are set up with the facility and also how it's going to be managed. So if I don't have a Red Cross volunteer, it doesn't mean that it can't be Red Cross supported, and that eventually we can kind of take over that if it's going to be sustainable longer term and remove that burden. So the hope usually is when I talk about conversations is that for Tillamook County right now, my current plan is that I can probably open a shelter with Red Cross volunteers outside of your county. Within 6 hours, I could probably get enough people to be able to sustain a shelter location. If I can't because of access point or something like that, then that kind of extends my timeline until I can do that. Hence, we want to be able to have that partnered or supported Red Cross shelter Because then, until I can get here, maybe 2 days later, then all we do is a quick handoff of transition because you guys are using the same forms. You guys have been trained very similarly and understand the process. That is an easy handoff. And then now we are now a full Red Cross shelter that relieves that burden from you guys and allows you guys to focus on other areas. So that's the hope that we want to try to build capacity within doing that, is that we can kind of figure out what that timeline might look like for people. Does that address your question, ma'am? Okay. Any other questions? Yes, sir.
You mentioned you respond to what I thought I heard 9 single-family structure fires
On average, a month.
a month. Is that in the state of Oregon?
No, so the state of Oregon, that's a little bit higher than that. But just within the counties that I oversee, that's my average. On the coast, what I normally see is about 4 to 5 a year. As far as how many, one, that has to do with population, and then also two, there are some times that there is a house fire and we don't even know about it because no one called us to provide services to them. And that's the part that I'm hoping to alleviate that. At least let us know to support them, even if it's not a huge amount going on for that. Because our hope is that if a family is displaced and doesn't have resources, we can be there within the hour to 2 hours at most to provide that. And we have different ways to provide that. So if I can't get a volunteer because it's bad weather or it's at 2 in the morning, I just don't have anybody available, which is always a challenge for me because I don't have enough volunteers on the coast. Then I can do remote things, meaning I can call a hotel and reserve it through the Red Cross, and I can go ahead and make sure that they still have a place to go, and then maybe the next day when it's a better condition and I can find somebody, then we can address other needs. But we want to make sure that they have a safe place to go and we address whatever is needed, because a lot of the other times as well is they may need medication. And we need to know how urgent is that medication. Do they need it within a couple hours? Like maybe insulin or blood pressure. We want to make sure we have a volunteer address those concerns. So that's the hope that we try to do, is that first responders or 911 centers or even their neighbor calls the Red Cross and says, hey, my neighbor just lost her house. Can you provide services? Then we'll check in with the fire department and then we'll make sure we still connect with them and get those resources going for that. Does that address your question, sir? Okay. All right, and as far as when we start recovering from that, as far as how we approach that is as far as making donations, staying connected with what's going on, neighbors helping neighbors, making sure they understand how to do that, transition to prepare for Blue Sky. I'll refer as far as what Blue Sky here is in a second. So the things that we provide is casework and recovery planning. So we'll stay with the family for up to 30 to 45 days to address any needs while they're recovering through that. That includes if it's a state level or a little bit bigger of a disaster, then we'll connect them with those services to make sure they understand what is being available during that. During the wildfires, some of those programs kind of inundated as far as how much funds they receive for supporting them financially to kind of get them good. If there was additional donations during that time frame that was earmarked for that specific disaster, and we found that money to be shuffled back through everybody, then we'll add that additional funds to them. Going back to the community, going back into supporting that element. So it's always finding out how to recover and plan around that so people have access to those needs, and we can kind of alleviate that as best we can. But it has to be driven by a lot of partnerships to be able to do that, because our services only kind of go so far for certain components. So we'll also do disaster assessments, which help when you need to do declarations or to be able to approve the ability for you to be granted access to certain programs to the state or federal level. Our assessments are based on that component, so it makes it a little easier to transition. We'll do a lot of lessons learned, and then we'll also do a lot of partnerships to try to do a resource center. So one of the things that we try to do if there is a bigger disaster is have a day that people can know when to show up and be able to talk to people about different resources, local resources. So we want to make sure we invite them, like, on this Saturday, all these different entities are going to be in one location, accommodate the public, and making sure that they can show up and they can actually talk to the people they need to talk to figure out what makes sense for that household to recover. So being able to create that space for that is ideal for us to make sure we kind of address that. All right, so we work better together when we have a lot of partnerships. All right, these are just some of the ones that get highlighted for us as far as how we do that. There's a lot of local and far more partnerships that we have that I could probably put in here. It'd probably be multiple slides to do that. But we try to make sure we do that. A lot of times, some of the services that we don't provide necessarily, we'll partner up with somebody else that can provide those services directly. Some of the ones that get provided at shelters, bigger shelters, is child services for disaster stuff. We have some partners that kind of do those services. or that maybe they have component or access to networks that are outside of what we have available from our volunteer source, like health services, then we'll tap into that resources and ask them to provide that additional resource. So it's a lot of partnerships to make sure we can, holistically, as a whole, try to take care of the community and try to figure out where we can do that. So these are just a few little numbers from my perspective as far as what I have in the system, as far as what I'm tracking for Tillamook County specifically. So preparedness is one of the programs that kind of goes pretty common around our county here specifically. We hope we continue doing that and creating different spaces to really address those underserved communities, to understand how to be prepared and understand our programs are all free to them, to include like smoke alarms and then the education and stuff like that. And then also we're providing hands-only CPR as well, which doesn't really cost them anything. It's just kind of being able to be available for that. And as far as what we respond, as far as we have a shelter, 2 shelter trailers in the county. One is down in Tillamook by the fairgrounds, and then one is here in Manzanita, which is right outside. And disaster workforce, what I have is I have 23 volunteers in my system for Tillamook County, but only 10 of them are actually pretty active with me, or at least I've made contact with them. What does that really mean to you guys? Is that means that a lot of times volunteers that come through us either are only available when there's a disaster, or are not involved in anything else that is ongoing progress, like preparedness information or updating shelter information, which are things that we constantly need to keep updating, not like every single month or anything like that, but it's a project that we have to make sure we upkeep, because we want to make sure it's accurate, because if we have a disaster, we want to make sure it's the most valid information, we know who to contact, because there are turnovers, whether it's volunteers or officials or facilities. We want to make sure we're active in those components so we can be efficient when that comes up. So we try to keep working on as far as partnership and collaboration capacities for us to do. Temporary evacuation point support. So what we have introduced is kind of like an assembly area concept, which I learned even the cities have that, which is phenomenal. But what we kind of do is figure out what is the county going to do as far as looking at it, that if people had to leave somewhere, are they going straight to a shelter, or are they going to an assembly area or a rally point to gather information and figure out what's going on? So one of the ways that we're supporting that is we have what we call a little temporary evacuation point kit. And really in there is just gathering data as far as their information, and then making sure that we can support them for about 12 hours to 24 hours and addressing like water, snacks and stuff like that, until we figure out if they can go back home or if we need to open a shelter. Because the last thing we want to do is get everything set up for a shelter and find out that people can go home. We want to be efficient with our resources and be accommodating for that. It is donations that we're using through this, so we want to make sure we're purposeful about that. And that temporary evacuation point or assembly area really allows us to evaluate what the situation looks like and what can we start addressing for that. We're constantly trying to update our shelter capability and responding as far as making sure we identify the locations. Right now there's 32 on the system that I have for Tillamook County. So we need to make sure we update that to be adequate, to make sure it provides ADA information, if it can accommodate that, what the PED policy looks like for the facility, how are they going to be managed, meaning do they want to be Red Cross managed, supported, or independent shelters, so we can document that information. And also gives a good point of contact. Has there been any updates to the location? Things like that, to make sure we understand as far as what's going to be addressed. Because overall, the population that will get evacuated and actually show up to the shelter is not going to be the same number that you'll see in the news. 1,000 homes being evacuated doesn't mean 1,000 people or 1,000 families are going to show up to a shelter. On average, we see about maybe 10% at the most. So we want to plan around that, but also understanding that 50% of the people that are going to show up to a shelter are going to have some functional needs, access, or some challenges. So we need to have the ability to support those needs, or find out if there's any partners that can address those needs. The biggest components we run into is basically helping people kind of for mobilization. Maybe they need transportation, which we don't do transportation by any means. So those are some of the challenges. Also addressing maybe medical equipment or medical power available to them. We don't want it to be in a shelter location where we can't address those needs, and it creates a harsher condition for them than really what a different facility could possibly provide through a partner. So that's why we want to have those conversations, really understand who we're going to be supporting in the community, and what does that community look like as far as the people that might be seeking the shelter for that. So that way we can make sure that we welcome that, to make sure we can address that as best as possible. All right, and as far as recovery stuff, I have one volunteer specifically here that deals with recovery casework as far as following up with that, but we're always in need of following people that want to be able to provide casework, which is talking to the client, figuring out what those needs are, find what roadblocks we can address, and then help them kind of navigate through the days as far as what that looks like for the family. Sometimes it could be as simple as the kids lost their computer, their tablet, we'll reach out to the school, or we'll find a partner that's willing to donate that to them, things like that, figuring out what makes sense for that family so we can address those components. Any question as far as what I have for Tillamook County specifically? Yes, ma'am.
What would you like to have for Tillamook County?
Yeah, great questions. As far as what I would like to hopefully see for the county is the ability for us to provide enough preparedness information to people understand the reality of if there's a disaster, what they can actually expect in their own community, where those locations are at. So making sure like the prepared guides that I have there, those are great little simple booklets that people can kind of use as a great starting point. But from that, making sure we can address as far as what does the work look like for mass care services overall in the county, meaning who can support the sheltering component, who can support feeding components, who can support the networking and coordination components, and helping identify those people that can support that, or figure out if that's a need that I need to build, so that way we can come and provide that need and find the right people that can do that. Because it is a challenge to figure out, who has interest in those specific spaces to make sure that they have the comfort and support that they can do for the community good for that, and figure out those partners that work for that. Yes.
How much do you know about what the Emergency Volunteer Corps in Manila Bay does? Because there's a lot of overlap with what you're talking about.
There is, yes. So I know quite well exactly what you just do. So
7 hours together.
yeah. So the hope is that we don't replicate the efforts that are being done. So if they're being addressed by somebody, I can now focus resources somewhere else. So that way we can make sure that we're collaboratively working together, so I can focus where those needs that are not being met by a partner can be addressed in that manner. One of the main challenges is figuring out how long can that be sustained for, and then also, where's the handoff if it needs to be done, so we can communicate that piece, but also who's involved in the conversation to make those decisions to do that. Because a lot of times, it may be just us and yourself talking about this, but then where's the rest of the community knowing about this information, and where are they involved in that, or do they understand as far as how do those services get activated, and how long can we actually sustain that? So that way they understand what the process looks like, so that way people don't get frustrated when there is a need, and they understand that certain things kind of are going to be worked because there's a different entity that might be supporting that. So that way, a lot of times they'll be like, well, where's the Red Cross? Why is it not Red Cross? Well, that's because you guys are supporting that element. We want to make sure they understand that that's the partnership that has been worked on that makes sense for the community. And that's what we want to make sure we balance out, is that we don't duplicate efforts, we can focus on the right areas, and we can build capacity in those areas that are not available through organizations that are available here in the community. Does that answer your question, man? All right. Yeah, any other questions? All right. All right, so how to be able to help. One of the biggest things, like I said, as far as partner organizations, we want to make sure we're able to achieve that. So collaborate efforts and involve dependent of capabilities, like we were talking about. What are your capabilities? How long can you sustain? Where's the handoff if it needs to be done? How do we collaborate to make sure we can communicate that? Because one of the things that a lot of counties and cities have seen is that a lot of people are doing the same thing, but nobody knows about that, or it's not being communicated, or doesn't know which stream of information needs to be communicated to the public. A lot of times people say, well, if they are part of my Facebook, they'll know about it, but not everybody's part of that, or not everybody sees the news, not everybody's on the radio. Maybe there's people that don't live here, don't know where to find that, or don't know which website to go. It's clearing up that messaging and communicating that, so we know how to use the resources, and also collaborating on how to make sure we're not duplicating efforts for that. So figuring out good partnerships for that, really where are the strong suits for those specific services, and making sure we can kind of balance that out as best as possible. Event-based volunteers. All right, these are what we call spontaneous volunteers, or there's a need that I want to help and I want to go show up. I heard you guys have a shelter. I show up and I want to help. Who can kind of take me in? I have these skills. I have a chainsaw. I have a truck. I have a trailer. All these things that people want to do, which we're very thankful about. We want to make sure we track or use the resources with the right organization they can take advantage of those resources. Because that's where we want to make sure we duplicate efforts and we can use the people's ability to want to help or the skill sets to be with the right organization that can take advantage of those skill sets. You know, it may not always be the Red Cross, but if they do come with the Red Cross, there's limitations to that, and hence some people might get frustrated, which is like limited capabilities. We do a quick background check, so if you show up, you know, within 24 hours, you can come back and then help in the disaster, because we do a background check. That's part of our process, and making sure people that are going to be able to do that. And then from there, you may not be working through the shelter specifically. You may be sorting water or helping out, organize other things, or welcoming people. You know, it's going to be very limited capabilities because we do just-in-time training, which is like maybe an hour or 2 hours of like talking to you of like, hey, this is what you're going to help with. You know, sign up for a shift, and you can only help for 6 hours at a time. So you got to sign up for shifts. So it kind of limits the capabilities when it's event-based. But we do use those a lot. So if people don't want to be fully vetted Red Cross volunteers, not a problem. But if they do still want to help through us, you know, it just takes 24 hours and they're available for 6 hours at a time. A lot of times this is kind of where health services like nurse practitioners or nurses or people that have licenses, they will help on this capacity. Is they're not fully Red Cross, but they can help with those services, or we can refer them to get those services to still address the needs for that. So there's a lot of kind of figuring out what those elements look like. All right, and as far as being a full general volunteer, as far as we call it, fully trained and vetted volunteer, we complete a full background check for that component. We provide the training as far as what you want to be able to help in. And also support over 6 hours. So you can be deployed up to 2 weeks. So if it's something here locally, you know, we look at, you know, can you support for the next 3-4 days? Yes, I can. Or no, I can't, Victor. You know, I got vacation. Okay, no problem. When will you be back? You know, can you support maybe 7 days because we're going to be in this for the next 2 weeks? Yeah, sure. And that's where we figure out. Or if you want to be able to support just in overall, we can deploy you to go further than just the local area. And you can go up for 2 weeks and support, you know, down in the Gulf Coast or East Coast and be out there supporting on the Red Cross mission that we do for those things that you're certified to do in those capacities. All right, and we pay for everything to get you there. We provide everything you need there, and then come back, and hopefully through that experience, you learn a lot of what the Red Cross does, but also you can bring that experience back home and hopefully kind of bring some clarity and some awareness of, hey, this is what I saw, this is what we need to focus on, or hey, I want to be more involved, or at least understand the experience that goes with that. As far as how engaged you have to be with the Red Cross, it really depends on what space you're in. You know, if you're a presenter of preparedness information and readiness stuff, it's however often we have presentations or we get into the schools. You know, those opportunities will come and go. Be able to make sure we communicate that piece. And then also the blue and gray sky concept as far as what we do projects. So has anybody ever heard of blue sky or gray sky? All right, so that's just another disaster way of kind of talking about information. And so blue sky, think about it, it's clear right now, there isn't a disaster. So our best time to now get ready and preparedness and plan around that is the perfect time right now during blue skies. You know, the last time we want to be able to do is when there's a gray sky, meaning there just something happened, now we got to scramble to kind of get services going. Then that's not the time to start planning any of that or hope for any of that. Now we actually got to execute on what we've been working towards, or building, you know, training or a lot of that focus or conversations, and knowing how to activate the services. Hence that gray sky component is now we are actually going to get our hands dirty, actually be out there helping the community, actually doing things in the community. So that's the balance point. So as we're doing gray skies, a lot of volunteers won't deploy, or a lot of services won't get activated because it's not their specific time frame to get involved in that. So it's balancing now as far as why people say like, whoa, we have a disaster in our backyard, and people are still shopping, doing their normal thing because it doesn't impact them. You know, they go about their day, and I've seen that quite often as far as like we have a shelter open, but some people that are not impacted just go about their day, and that's okay. It's just understanding that certain things will get activated and different people focus on different things. And if disaster stuff is not your cup of tea, that's okay. We always have different opportunities to do that, like we talked about some of the other lines of service, to kind of get involved with that. It can get a little bit hectic, but it depends on how you want to support that and how you want to be involved with that really makes a difference. So it doesn't have to be disaster specifically all the time. There's other ways to support and kind of communicate that information, like I said, as far as awareness that goes with that. All right, so that was from one of our disaster academies. So we do a disaster academy here in our region, which basically is every May we put a lot of instructors come over and we provide instruction on a lot of the higher level of training stuff. How to be a facility leader, collaborating essentials, learning how to collaborate, building more tools, bringing up people to be supervisors and managers of different capacities. We bring those opportunities during the month of May because we know that it's right before we're going to start getting it right into the season. We want to get people promoted into things that they can do more of an impact, have a little bit more oversight, be more involved in that. So that's why we try to focus on those components. So any questions as far as how to kind of go that? That information is also on the table as far as how to be involved or kind of coordinate. And if you have any questions regarding what those opportunities look like, it's always about understanding where do you want to start at and eventually where do you want to go. A lot of times we'll have volunteers that will be volunteers for years, take a pause, and then come back. And that's okay. The whole component is that we are looking at how we can holistically take care of the community, whichever means we have to use the resources available to us. So we don't ever want to bottleneck any of the progress. We always want to make sure we have someone that's moving the agenda forward to continue to improve and be more efficient in the way that we support the communities before it does happen. Take advantage of the blue skies as much as we can until we got to worry about the gray sky component.